to meet you. Okay, so what are you in for today? Yep. Okay. Yeah, so I can do an ENT assessment on you. Okay, so that means we'll be checking your ears, nose and throat in detail, just to check if there's any problems in any of those areas. Okay, yeah, so was it your ears, your nose or your throat that you were most concerned about? Okay, so we'll kind of go through roughly in that order. Okay, let's just start with a few quick questions. So could you just confirm your name and date of birth? Okay. Yep, date of birth. Good. Okay, right. Have you had any problems with your hearing lately? Okay. Have you had your ears cleaned recently? Okay. Any problems with balance? Okay. Headaches? Okay. Changes or problems with your sense of smell? Okay. Your sense of taste? Okay. Any kind of nasal problems like a runny nose, blocked nose, feeling of congestion, anything like that? Okay. Any problems swallowing? Okay. Any dental problems? No. Dry mouth? Sore throat? Okay, alright, no, that's fine, that's enough for now. Okay, so we'll crack on. Just gonna start with a little bit of a quick hearing test, okay? So, you think your hearing is fine, did you say? Okay, well, I'm sure you'll recognise this from your previous hearing test, but it's just going to be a quick whisper test. Whisper a few words in this ear and a few words in this ear, and then if you just repeat them back to me. Okay, right, so we'll kind of alternate then for you. Chocolate. Good. Pancake. Yes. Okay. Blanket. Good. Okay. Couple more. Light bulb. Yep, that's very good. Floorboards. Perfect. One more. Okay, just to even it out, but no problems at all so far. Cookbook. Good. Okay, that's fine. So what I'm gonna do is make a sound a bit like this, okay? If you just tell me if you can hear that sound at certain distances from your ears, okay? So we'll start close, alright? Okay? Yep, and if I just come back and back again, back again. Okay, I'm gonna step back again and just tell me when you can't hear it too well. this time I'd like you to close your eyes, okay? And we're going to just see if you can identify sounds in your left ear or in your right ear, okay? Yep, so you can either respond left, right, or you can raise one hand depending on which side, okay? Good, yeah, so it'll just be this kind of soft sound again, okay? So go ahead and close both eyes. Good. You're right, okay? Again. Your left, good. Okay. The middle, okay. Okay, yep, the left. And both. Okay, perfect. Okay, no problems with your hearing whatsoever. So what I'm gonna do is go ahead and pop on a pair of gloves. Okay, and then I'm gonna be examining the outer ear, the bone, the cartilage, check that's all intact, and then we'll have a look into your middle ear and your deeper inner ear, okay? So have you had a good day? Good, good. Yeah, me too. Not been too busy today. Okay, so should we come over and do this here first? Okay, so like I said, I'm just going to be touching around your ear, okay? And if you can just tell me if you feel any pain or discomfort, okay? And I'll tell you if I can detect anything out of the ordinary. Alright, okay. So I might need to come quite close to you for this. Is that okay? Perfect, okay. Okay. Okay, can you feel that? Can you feel any pain? No? Okay, so no redness on the skin, no irritation. What I'm going to have to do, if you don't mind, is just kind of tug your ear, kind of pull it in all different directions, pull it forward, pull it backwards, pull it down, just to kind of check that it's quite flexible and malleable, okay? Good. Okay, that's fine. Any pain? No, any discomfort? Okay, good. Good. Yep. Just gonna tug down on your earlobe now. Okay. Good, good. And now I'm just kind of feeling, just gonna do a gentle press, okay? All the way up the cartilage, okay? Okay, good, good. All seems fine over on that side. So let's move over to this side. And are you you sure there was no pain? No discomfort? Okay, so that was okay, was it? Good? Alright, let's do this one. Right. Good. Perfect. Okay, and again, just going to be kind of pulling your ear, bend it forward, backwards, pull it down, just to check how strong and flexible your ear is, okay? Good. Yep, that's good, that's fine. And again, just tugging on the earlobe. Okay, and then again, just pressing all the way up the cartilage, okay? Okay, yep, perfect, perfect. Yeah, no redness, no signs of inflammation, no dry skin. It looks like you take really good care of your ears, and it looks like you've been taking good care of your piercings as well. Yeah, oftentimes people come in here and I can tell that they're not actually cleaning their piercings. Dry, crusty skin, but that's not an issue for you, so brilliant job keeping on top of that. Okay, so now I'm going to take an otoscope, okay, which is like a little light, okay, attached to a magnifying glass, and what I need to do is actually place this in your ear so that I can get a good view of the middle part of your ear and the inner ear, okay? Okay, good. Right, so we'll come back over this side. Okay. 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 So in the middle part of your ear, I can see your tympanic membrane, which is actually your eardrum. Appears to be completely intact, so that's good. And then further in, I'm just going to have to push it in just a tiny bit more, but please do tell me if it's too deep, too uncomfortable, if you need to take a break. Yeah, it's completely fine. Okay. Right, so into the inner ear, and I'm looking at your vestibular nerve, your cochlear nerve, and semicircular canals. Okay. Okay, good. And you said no issues of balance. Good. Okay, and let's have a look on the other side. Yep. So again, the middle part of your ear. And we're looking at the tympanic membrane, which is your eardrum. Any loud sounds recently? Anything that's given you a jump, kind of frightened you because it was so loud? difference between when it's been cleaned by a professional and when a patient has just cleaned their ears themselves. Often people think they're cleaning their ears, but they're actually just pushing wax further in. But your ears were in absolutely perfect condition, so just try to keep maintaining that, maintaining your regular appointments, and your hearing was great. Okay, so we're going to have a look in your nose, okay? Now, first I'm going to look along the outside of your nose, as in the bone structure, the skin, okay? And then we'll be using a flashlight to look up your nose. So just to recap what you said at the beginning, when I asked you if you had any nasal symptoms, you did say that you've been getting a runny nose. Oh, a blocked nose. Yeah, runny nose, blocked nose, okay. And your sense of smell. Okay, and how about snoring? I know that's kind of a strange question, but it can be relevant. Okay, so I'm just going to start by pressing on your nose. Okay, just tell me if you can feel any pain. Yep. Okay, good. Good, good. No pain. Nope, good. Discomfort of any kind. Okay, yep, so the skin of your nose is intact. No redness. Looks like there's no sensitivity there. So that's good, okay. How do you feel if I just occlude one of your nostrils? Yep, so I'll be pressing on it, okay? Good, I'm just going to cover this nostril, and if you can just do me a favour and breathe through your nose. Out through your nose, good, and again. Perfect, and then the other side, just going to cover that nostril. Breathe through your nose, out through your nose, and again. Good, okay, perfect. No swelling whatsoever. Okay, good, good. So what I need to do now is actually pinch your nose, okay? So I'll be pinching the tip of your nose and then pinching all the way up the bridge of your nose, okay? Just tiny pinches. You shouldn't feel any pain, but of course, let me know if you do. Okay, ready? Good. 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 Okay, yep. Just quick, tiny pinches. Quick, tiny pinches. Good, okay. Now you're going to feel me place some pressure either side of your nose, okay? Just to feel your sinuses, okay? Okay, yep. Seems fine. No pain. Discomfort. Have you ever had any problems with your sinuses? Okay, right. Now, to take a flashlight. It is a little bit bright, okay? Now I need to look up and inside your nose. So a lot of people aren't too comfortable with this. It's not my favourite part, but you know, it needs to be done. Okay, so if you tilt your head up and back just a touch, that's good. That's good. Okay, and I'm gonna place my fingers on the tip of your nose and lift up, okay? And then I'll be using the flashlight to look up inside your nose, okay? Good. Alright, I might need to come close. Okay. So with this blocked nose, how often do you get that? Yep. Okay. And the snoring? Do you have a partner? Do they tell you that you snore quite a lot? Okay. Not to worry. Okay. Yep. Good, good. Just gonna kind of do one nostril at a time. I do apologise. Okay. Okay, so what I can see, no redness, no irritation, no inflammation, but I think I can see a little tiny polyp, a nasal polyp. Do you know what that is? Okay, so it's like a soft growth, okay? Completely benign, harmless, painless, not cancerous, just a little growth up in your nose, and it can kind of cause some of those symptoms that you said, blocked nose, snoring, okay? So yeah, it's not a big deal at all, but I'll give you a steroid nasal spray. So what you can do is just spray that up your nose once a day. Alright, and that should take care of that. Okay? Nothing else. Yep, and it's a very small one. Yeah, no, they're not a problem really. They just, if left untreated, they can grow and then they can just cause more congestion and blocked nose and sinus problems. So it's better to treat them rather than leave them. Okay. But otherwise, yep. Otherwise than that, everything is looking very, very good. Okay. So if I just ask you one more time to cover each nostril, okay? I'll do it for you. Take a deep breath in through your nose and then out through your nose. Good, good. And this side, deep breath in through your nose, out through your nose. Good, perfect. Thank you for doing that again. Okay, now for your throat. So we'll take a little breather, okay? Take a little moment so that you can just have a little bit of space and time to prepare, because I'm going to be asking you to open your mouth as wide as you can for as long as you can, okay? So it can be a bit uncomfortable, and by all means we can take breaks whenever you want to, okay? Just jot down notes. Yep, so the outer portion of your ear, fine. No, sorry, that's completely fine. Septum. dilation, a slight polyp. Airflow was fine, which we tested that twice. No deformities and pretty much perfectly symmetrical. Okay, so what we're gonna do, when you're ready, I'll ask you to open your mouth, and I'll just be looking inside with the flashlight. Alright, okay, let's have a look at the outer mouth first, so you can keep your mouth closed, and I'm just gonna feel along your jawline. Okay, that's good. Okay, and then, kind of open your mouth. Okay, and if you can just show me your teeth. I know it's a bit awkward to do. Okay, just gonna kind of pull your lip down there. Okay, and pull your top lip up. Okay. When was the last time you went to a dentist? Okay. And do you brush your teeth twice a day? Good, good. Just, I would say, the front of your teeth are looking lovely and pearly and white. The back of your teeth could use a little bit of attention. So it is often a forgotten about area, the back of your teeth, okay? So just try to take a little bit more care when brushing those, and of course it's something that your dentist will be able to work through with you when you next go in. Okay, so opening up wide, okay, wider, okay, tonsils are intact. Okay. Good. 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 Open wider. Okay, can you put your tongue to the roof of your mouth? Okay, good. Can you move your tongue side to side? And then lay your tongue down. Poke your tongue out and lay it down flat. That's it. Okay. Okay, good. Good. Perfect. Okay. Good. If I can ask you to smile. Nice wide smile. Okay, and open your mouth and say ah. Ah. Yep. Good. 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 Alrighty. Perfect. Yep. So ears were perfectly fine and intact. Throat, mouth, very, very good condition. No problems I could see there. Nose pretty good. Slight polyp. I'll send a prescription over to the chemist for you later on this afternoon, okay? Yep. But anything other than that, you're all fine? Good. Yeah, it's good to get checked over every once in a while. Alright then, well, thank you for coming in, and don't forget to book in for your annual physical checkup if you haven't already. Perfect, okay, yeah, you can do that at the reception. Great, okay, see you soon, goodbye.